Hello, I'm Professor Eliza Wong from the JC School of Health and Primary Care at the Chinese University of Hong Kong. I'm pleased to share our recently published paper, Evaluations of the Gamification-Based Intervention to Enhance Intergenerational Communications, Pre-Post Mixed Methods Evaluations in JMIR Aging. Social isolation and loneliness are major challenges in aging society worldwide, partly driven by changing family structures and fewer opportunities for social connections. Many existing intergenerational programs focus on bringing people from different generations together. However, simply meeting people from different generations may not be enough. What matters is the quality of the conversations and connections that developed. Tools that help people start meaningful conversations and build relationships are still limited. To address this challenge, we developed a gamified intervention, Healthy Aging in Dialogue Tabletop Game. The game was designed to follow our LOUE communication framework: listening, observing, understanding, and expressing. These 4 skills are fundamental to effective communication. By strengthening these skills, the game aims to support richer conversations and more meaningful social connection. Using a communication framework, we designed a card game with conversation prompts, shared activities, and health-related topic discussion that encourage participants from different generations to speak, listen, learn from one another, and enjoy the experience together. After playing, participants reported that conversation felt easier, more enjoyable, and more meaningful, and that the game effectively brought different generations together. We also find improvement in communication skills and knowledge about healthy aging, with particularly strong benefits among older adults. Most importantly, the game created a structured and comfortable environment where people could share experience, challenge stereotypes, and build mutual understanding across generations. Why these findings are important? Our findings suggest that simple, low-cost, communication-based interventions can be effective and enjoyable, making them more likely to be adopted in real-world community settings to enhance social connection. Why we choose JMIR? It is a leading journal focusing on innovative approaches to health promotion. Our goal is not only to understand social isolation, but also to develop practical solutions that communities can use. As an open access journal with a global readership, JMIR Aging is an ideal platform to share evidence that support meaningful intergenerational connections worldwide. Thank you.